Good evening, everyone. My name is Ella Wilson, and I am from Kernersville, North Carolina. I am a children's Christian book author, and I sell topical pain products. I'll be introducing our speaker tonight. The Save a Life campaign is a community-based health initiative aimed at reducing preventable deaths, particularly from fentanyl and opioid misuse. Focused on North Carolina and expanding nationwide, it addresses disparities affecting Black and Latino communities. Despite a 4% national decline in opioid-related deaths from 2022 to 2023, deaths among Black Americans rose 3%, prompting targeted outreach, harm reduction, and education efforts. The campaign, led by Sandra Miller Jones, Lafayette G. Jones, and Alvin L. Atkinson, began in Forsyth County using partnerships with churches, barbershops, and beauty salons. Its goal is to expand prevention education and Narcan distribution. Learn more at https://savealifecampaign.ai. Sandra Miller Jones, founder and CEO of SMSI and Healthy Living Solutions Incorporated. Lafayette G. Jones, president and CEO of SMSI Marketing. Alvin Atkinson, Empowering You host on WSNC 90.5 FM at Winston-Salem State University in Winston-Salem State, North Carolina. Black welcomes you.
This is Lafayette Jones. First of all, thank you, Dr. Davies, so much for having us on your show. This represents our 6th or 7th year being a platinum member of your organization, and we've learned so much. Tonight, we want to talk about a subject which is close to our heart. And Mr. Davies, Dr. Davies, thank you for that film on opioids. It's a complex subject. Here's the agenda and the first thing we're going to do is show you a campaign video, which incidentally was created by Karen Moore, who is a member of Black. And the importance of that is one of the things by being a member of Black is you meet so many talented people. And Karen Moore and her husband, who did the video for us in remarkable 2 days, are those kinds of folks. Next, we're going to talk about some information in terms of our background, and Sandy Miller Jones, who's my life and business partner, is going to explain the campaign and how to use Narcan. And then finally, we have a superstar with us, Alvin Atkinson, who we've been associated for the past 30 years. And he is a key supporting partner. He is the host of Empowering You, which is a radio program which we've converted to a podcast, and now it's called Empowering You, the Save a Life series. Now, you asked, how did we get started as marketers in such a program? We're going to show you a film and tell you why it's our passion.
Every life is precious. Every heartbeat matters. But too many lives are being cut short by preventable causes, including improper opioid usage. Families are left shattered, communities are hurting, and the time to act is now. The Save a Life campaign is more than an initiative. It's a movement to educate, empower, and equip our communities with the resources they need to combat the opioid crisis. Led by SMSI Healthy Living Solutions, a trusted national grassroots marketing company founded in Chicago in 1978, now based in Winston-Salem, North Carolina. This campaign employs proven, life-saving tactics to make a real difference. Our approach is simple but effective. Meet people where they are. SMSI community ambassadors will visit churches, businesses, and community leaders, bringing critical life-saving information. As we launch the Save a Life campaign, we are honored to have the support of organizations and individuals who believe in this mission. Now, hear directly from some of our strongest supporters, those on the front lines, those who have witnessed the need, and those who stand with us in making a difference.
Two of our most recent partnerships that attest to SMSI exceptional capabilities include the Kate B. Reynolds Foundation's efforts to raise awareness of Affordable Care Act insurance opportunities, and the Federal Communications Commission's mission to encourage participation in their Internet subsidy program, the Affordable Connectivity Program. In both instances, SMSI used their outreach ambassadors, urban call publications, and community-based contacts to over-deliver on their contract commitments. SMSI delivers on time, on point, and in budget.
My confidence in this proposed campaign stems from the insight that I have received while working on the opioid crisis in Forsyth County and beyond since 2021. Education, awareness, and access to Narcan save lives. The SMSI campaign addresses each of these measures within our community. In support of the SMSI proposed campaign, I have secured a one-time contribution of 1,000 Narcan kits for distribution by the campaign. I am committed to providing additional advice and assistance to the campaign as needed. Forsyth County's support of the Save a Life campaign is key to saving lives, and all resources provided are an investment in our community.
My friends Sandy and Lafayette Jones share our passion for community service, and we have worked with their company, SMSI Healthy Living Solutions, on many occasions to meet our mutual goals. We have shared their urban call publications with our customers, provided space in our facilities for their ambassadors to educate consumers on many health-related issues, and partnered with them on other worthwhile efforts. We are excited about partnering with them again on the Save a Life campaign.
As president of the Forsyth County YWCA, I can see many ways in which SMSI's Save a Life campaign can enhance our missions. The initiative will be especially helpful in raising awareness of our Holly House services and our diabetes prevention program. There is a disproportionate need for these services in the communities in which the Save a Life efforts will be concentrated.
In recent years, the Forsyth County Department of Public Health has worked successfully with SMSI Healthy Living Solutions in several ways. Perhaps most relevant were the marketing input that SMSI provided for the startup of the Healthy Forsyth Initiative and the development of custom urban call publications to enhance community awareness of our services.
These organizations, as well as our thousands of SMSI network churches, beauty salons, and barbershop partners, as well as historically underutilized businesses in our communities, stand with us and our mission to save lives in our communities. This is not only a campaign, but a call to action to save lives by being prepared, using proven prevention techniques, and supporting existing programs. Together, we can save lives.
Thank you. I'm not sure how we got this distorted video, but I assure you it was a very well done video. Somewhere in the transmission, it hasn't come out clear, but it is clear. Nevertheless, you're listening to Empowering You, Save a Life series brought to you by Every Dot Black Mastermind and WSNC 90.5 FM radio, and SMSI Healthy Living Solutions and Urban Call Marketing and Communications. And together we're building community strength through health, hope, and healing. Yes, how did we get started on this? Many years ago, as we developed our company, this is our 40th year, and you'll hold on the slide changes, please. Before we went exclusively into the health field, we decided that we wanted to do things that would be beneficial health-wise, because that's one of the keys to success for our community is having good health. Health is wealth. And so one morning, Sandy woke up and said, we should go help President Obama. And we did. And we helped with the Affordable Care Act. And Sandy and her team was able to expose more than 500,000 people to the opportunities there. Next came another campaign. We read a lot about our children and our elderly and others, all age groups, Black and white, but in many cases, African Americans and Hispanics dying of fentanyl and opioid misuse. And so we took a look at it. The numbers came out that there was a reduction, as you listed earlier, but guess where the reduction was not? in our communities. So we decided to focus on underserved and high-risk populations in certain zip codes, and the campaign was designed by Sandra Miller Jones, who will tell you more about it. But we're using all of our 40 years of marketing and communications expertise and promotion and sampling to execute this program. Next slide, please. I think that Ms. Ella has told you a bit about Sandra Miller Jones, who I want to thank for her work strategically on this and some of my own. We have decades of leadership in the multicultural marketing arena and communications, with now a focus on our public health needs. When you really step back and look at our communities, you will find that our communities suffer from almost everything: diabetes, high blood pressure, you name it. So the campaign called Save a Life is certainly on the tip of the arrow, if you will, about fentanyl and opioid misuse or overdose, but it's really about saving lives. The fire department is trying to save lives. The cancer group, American Cancer, American Heart, they all have specific diseases and body parts that they're trying to improve on. At the end of the day, everyone, including you on this podcast, you're about the business of saving a life. If we can extend the lives of our population, we're on the right path. And also, um, we want to, this is certainly a big focus on African Americans and Hispanics as a leading group. But, good health is good for everyone and it's good for our country. Next slide, please. I think, Sandy, it's your turn to go now, is it not?
That was awfully quick. All right. Let's change seats.
And move along.
So thank you. Thank you, Dr. Davies, for letting us be on your show once more and to have the opportunity to talk to these outstanding leaders in their community and in the business community. We are especially grateful to be able to share with you some of the information about what we're doing, but what you can do also to kind of help with this problem that we have. I tell you, I did not realize how very much the devil loves young, creative people until we started this campaign. We, day after day, we talk with people who have lost their children, who have lost their husbands and their grandchildren, their grandparents. It's just an equal opportunity devil. This whole opioid and fentanyl and other kinds of opioid crisis. So our charge was to try to get out as much information as we could about this problem so that people could help each other to try to overcome it. And we know how to get information to folks. So we pulled out all of our stops to try to get as much information to as many people as we could. We partner with our churches and beauty salons and barbershops and other folks who are at the grassroots level talking to folks every day to get them information. This information has included the Urban Call publication, and Lafayette's going to tell you a little more about that when we get to it. But we are distributing in just our one county, in the Forsyth County, 30,000 printed copies of Urban Call. And then we're trying to reach out to other communities with 60,000 digital copies of the presentation. So we'll send you a digital copy of the presentation and hope that you will be able to share that with your network and your friends. Next slide, please. Some of our other, these slides are going pretty fast, but I'll just talk to as many of them as I can. Some of our other ways to reach folk, in addition to Urban Call, is we're actually training some young people and some older ones. I know one of our ambassadors, at least one, is on the line now, Mr. Malcolm Aside. Malcolm has said that he would like to not only be an ambassador going to opinion leaders in the community and trying to get their help, but he's interested in helping us to go door to door, talk to folk, take them some Narcan. I don't know if all of you know what Narcan is, but it's a way, it's a medication that can reduce an overdose and save lives right there on the spot. And we've seen it work for some people as we've learned more about this campaign. So we're going to be going door to door in the communities where the need is greatest to deliver some Narcan to them. So we're looking to at least go to 3,000 folks door to door. We also have our field manager, Jacqueline Lawrence, on the phone, on this podcast. Jacqueline is retired from from Haynes, from Haynes. All of our people are talented people and people who are interested in trying to help. So Jacqueline has retired from Haynes and she's come to work with us to do this field execution, and we're really grateful to have her with us because it's going to be quite a task reaching at least 250,000 folks in this pilot program. And again, we need your help to extend that reach from just our Forsyth County to other counties as well. We're looking forward to extending the reach when we have the opportunity to do it also.
You need to tell her when to move the slides. She's asked for that.
All right. Move the slide, please, if you would, Jackie. We've got.
Next slide, please.
I think if you will just go back one, please, Jackie. Okay. I want to share with you, we talked about Narcan. Let me tell you a little bit about more about Narcan and what we're doing with it. We have been given 1,000 Narcan kits, and these Narcan kits are very expensive. If one tries to buy them, they cost between $40,000 and $50,000 a piece. $40 and $50 a piece. So 1,000 of them is a great contribution. And let me tell you why we got this 1,000. The woman who provided this to us, a lovely woman, is not one of our political allies, but she is an ally in this fight to try to save some young people. She's been fighting this fight since she lost her 21-year-old son. And it was a situation that we've seen over and over again as we learn more about what's happening out here in the streets. This is a young white boy who had some problems, some mental problems, and had some addiction problems, and had left that behind him. He had been able to overcome all of that. And he accidentally took another opioid that he got off of the street, and he went to sleep and never woke up. So she's been trying to help people to understand what's happening, and so are we. So Jackie, you've got a film on, just a brief film on how Narcan can be utilized. So if you can you show that for us, please?
Mrs. Jones, may I come back to that one? Let me pull that one up.
Absolutely.
Thank you.
All right. Well, while you pull that up, I'm going to ask Lafayette if you will talk a little bit more about Urban Call. I'm going to change seats with you, okay?
Okay. You all have seen the cover of Urban Call and its call to action. Jackie, can you remove, Jackie, can you, yeah, thank you, remove the box. We can stop here on this slide. Urban Call was initially produced in 1993. And since that time, we've done more than 125 editions of 16 to 36 pages. And it's not like a regular magazine. In fact, it is a newsprint publication because we give this publication away. We've distributed more than 10 to 12 million copies in the last, since 1993, at whatever age number of years that is. So it's focused around a subject of passion. And in this case, it's about opioids. I'm going to go and see if I can pull up the cover to this publication. Jackie, I'm having a little problem finding this publication. I'll go to page 1 and kick it up. Okay, I'm going to share and let me know if you all can. Jackie, if you stop sharing. Okay. Can you all see that? Yes, no, anyone?
Yes.
Yeah.
Good, thank you. Well, this publication, Urban Call, again, produced since 1993. In this case, the cover page really talks about what some of the elements of the campaign are. Its public health mission, addressing community disparities that Sandy talked about. We talked about the leadership. We've done many campaigns, Sandy and I, and we're doing a pilot program in Forsyth County, North Carolina, using our large networks of churches, beauty salons, barbershops, etc. And then we are going out to all of our friends, starting with Jimmy Davies and all of you on participating today, to find a way to join our marketing together where we can meet people where they live, where they work, where they shop, they worship and play. And we're measuring for results, see if this works. We know it will work already. Our message is that the Save a Life campaign really unites all kinds of Save a Life. For example, you'll hear firemen talk often about talking to elders about don't go away from your stove when you are cooking because many of our older citizens are forgetful. Young people too. And that's where fires start. House fires are the worst ones. When you look at things like cancer and heart and COPD and other kinds of things that impact our community, we're always usually at stage 4. Stage 4 is the not the end of the road, but pretty close to it. So that message that we're trying to send there is go to your primary care doctor, ask questions, find out what your situation is. And that's is particularly true of the discussion directed toward Black men who are suffering mightily from prostate cancer. Stage 4, it's not too good. Some people survive it, but the numbers drop as the stages increase. And things like kidney dialysis. I mean, the bottom line, in my opinion, is our people suffer from the lack of information. That's biblical in many ways. But this campaign is all about getting you and me and everyone we can find to talk about how we can save a life. Someone's going to ask a question? Or I was, okay. On the front cover, you can see down the right-hand side, one pill can kill. We're thankful to Alvin Atkinson and his team, the work they've done with the YWCA and the sheriff. We're enlisting everyone that we know to help us solve this problem. Sandy?
Sandy, would you like me to share the video now?
Yes, please, because this is going to be, let me just close out. This video will be my closing comment. We want to be able to give Alvin Atkinson a chance to talk about the Empowering You show. So if you'll just close out, and that's the person who's helping so much here is Jacqueline Haynes, who's an outstanding assistant.
Years, Harbor Freight has been a reliable source for the widest variety of tools at affordable prices.
Sorry about that, Mrs. Jones.
No problem.
Narcan nasal spray is an emergency treatment designed to rapidly reverse the effects of a life-threatening opioid emergency.
Not her fault.
Right.
We just decided that we wanted to put that in, knowing us, we're always putting in ad libs.
Narcan nasal spray is an
Let me reshare.
All right. So we'll say thank everyone for letting us be here, and then Alvin will be the next person that you hear.
Let's move on. If you can bring it up, and we'll show it at the end, and we'll move to, if you're not able to bring it up now, let's move on, catch it up at the end, and bring up Alvin's PowerPoint 2, please.
I can, let me share. Apologize for the delay.
Not your fault. We didn't give it to you in time.
I have it pulled up. Let me just see if I can point it to my right screen. Do you see my desktop?
Yes, we do. Go ahead.
Let me, we're gonna do what you just said. Let me forward the PowerPoint, and let me do, Alvin, if you'll get started, and then I'll pull it up. It's behind this PowerPoint. So, Alvin?
Yes. Good evening, and welcome to Empowering You. Yes, that's what we want to talk about, is the partnership between the Save a Life campaign and WSNC 90.5 FM, Winston-Salem State University's public radio station, which features jazz in all its colors. I come to you also to share the fact that regardless of where you live throughout the country, you can listen to WSNC by downloading the WSNC mobile app to just listen to the great jazz music by going to the Apple Store or Google Play. And in doing so, you will, if you happen to listen on Sundays afternoon and at noon, you'll hear the program of which I host on WSNC. Next slide, please. At Sunday at noon, I come to our community to bring a program that is full of information about things, program services that can benefit all of us who live in the Triad community. And fortunately, what we do with Save a Life is empower individuals to save lives of themselves as well as their loved ones. And so each Sunday at noon, I have the pleasure in the Save a Life campaign series to welcome organizations that we call supporting partners of the Save a Life campaign to bring information to the community that saves lives. Next slide, please. What we wanted to do this evening was share with you individuals, and I'm seeing now that you don't see their names because probably the format, but these are individuals who have been on our program with Mr. Lafayette Jones and Ms. Sandra Miller Jones to really lift up the work that they're doing. We have Ms. Megan Reed with the American Heart Association on the left, and Ms. Lori Coker with the Green Tree Peer Support Program, coming and talking about the great work that they're doing with constituents whose without them they would have difficulty saving lives. Next slide. Some more guests that we've had. We've had the Forsyth County Sheriff, Bobby Kimbrough, who really is at the forefront of not just trying to arrest our way out of crime and drug use, but preventing that. And he's a great champion and partner, supporting partner with the Save a Life campaign. Next slide. Another great partner of the Save a Life campaign. In fact, we have two of those partners. You heard Ms. Sandra Miller-Jones mentioned the young lady who lost her son. She's in this photo with a picture of Jared and the foundation that she created, Jared 31 Forever, along with our fire chief, Chief Trey Mayo. Again, Lafayette has lifted up the work that the fire department is doing to save lives. And joining us in sharing that in this photo is Mr. Brian Anthony, the station's general manager, who is at the far left with Ms. Sandra Miller-Jones to the right, next to her husband of so many years, Mr. Lafayette Jones. And so next slide, please. Again, these are supporting partners coming on our show, talking about their work. Here we have Mr. David Daggett of Daggett Schuler Attorneys at Law, next to Sandy, and Lafayette next to myself. And David, a champion and actually a prostate cancer survivor who's been on talking about his work there, as well as his own Safe and Sober program in the effort that they're doing to promote keeping alcohol away from teenagers, now young adults. And so he's been in that space and now joining us for the first time at Empowering You. Next slide. Continuing, as I said, each Sunday we're having guests, and we have in this photo next to at the left, Miss Sandra Miller-Jones. Of course, that's me. You see me right there. I'm smiling because it seems like I have my arm around Miss Sandra Miller-Jones, and that makes me smile. But next to me, to the left, there is Miss Deandra Jones, who is with the Cone Health Mobile Unit, as well as the community outreach effort at Cone Health. And next to her, right in front of our banner, we have Ms. Denise Daniel, who's with the St. Peter's World Outreach Center. And next to her is Ms. Christy Rectus, who is the president of the YWCA in Winston-Salem. All of these supporting partners coming to be in the Save a Life campaign. Next slide. Here we have two individuals, Miss Christy Williams, who is the chair of the Creative Corridors organization, and Mr. Rob Eggleston, who is the president of the Twin City Development Corporation. Again, a wide range of supporting partners coming to Winston-Salem State University, to our studio, our campus studio, to share information that we send out that reaches over 200,000 people on our digital platform, and of which you can be a part of by downloading the Winston-Salem WSNC app. Next slide, please. The Save a Life campaign and WSNC 90.5 FM, pleased to be empowering you with information to save lives. That is what I have, and I'll leave it to Lafayette to offer closing remarks.
Essentially, we've gone out to all of our friends who have scale, firepower in terms of marketing tools and information, and asked them to come forward And when we talk about Save a Life, we talk about their campaigns too. This whole initiative is designed to really empower our community, to empower you. So we're asking those participants on the air, although we're now testing this program as a pilot, to tell us what you can do to help. You know lots of people. You go to churches, you go to beauty salons, you are a member of Every Dot Black, etc. The only way, one of the best ways, I should say, to conquer this challenge is by information. So, we reach one, teach one.
I'm going to step in, but I want to first of all thank you because what you're doing is really important for our communities. And one thing that I know working with Mr. and Mrs. Jones is that they produce a really quality publication, the Urban Call. And so if you're interested in getting a copy of the Urban Call to distribute to your community, please put your email address in the chat so that I'll send that any emails to you so you can reach out to them to distribute the Urban Calls. The other thing we just want to do is open it up for any questions that anyone has in the audience for tonight. Does anyone have any questions at all?
I think Jackie Lawrence was collecting the questions. You want to tell us what those questions are, Jackie, please?
I have three that Jackie Haynes had sent in. I think it was I'll come on camera. Maybe.
Just read one at a time and we can move forward.
Yeah, so she has submitted questions in reference to what is one new or important information did you learn from the presentation? If anybody wants to comment.
I was just gonna comment though. I've been hearing about opioids in the news, but it really didn't hit home until this year, 2024, when I've heard of several deaths of people that I knew or people that knew people I knew that have passed away, young people. And then followed up with that, I was able to go to Winston-Salem when you launched your campaign and learned even more about it. So it's really affecting all of our communities. It's really important that we learn about this and know what to do if we witness or see someone that's suffering from abuse, from addiction, or especially in the overdoses. And so I know you gave us the Narcan. And so, I just wanted to say it's really important that we learn about this because it is happening. Again, I've learned about two people, young people that passed away this year from opioids. So, I see Dr.
Go right ahead.
So we did have a hand raised. Dr. Gloria has her hand raised.
Yeah, I'm trying not to cry, but I know that Narcan saved my life, and where I live in Virginia, the fire department, they'll just do how some people do roadblocks, like old time roadblocks where they would check for drunk drivers. Well, in my neighborhood, which is all white, they have something similar, but they give out Narcan backpacks.
Isn't that interesting? Mm-hmm. Isn't that interesting?
Very interesting, mm-hmm.
Yes. You're really talking about the way they would do license checks, where they block off parts of the street when they're checking for inebriated drivers. Is that the kind of tactic they're using?
It's like a pop-up, and they actually have candy, like a big bowl of candy, but they're not giving us candy. They're giving us Narcan backpacks. Because I asked them, well, what's the candy for? And then they're just politely, just handing out the backpacks. But I think I've accumulated a couple of them. But we also have a lot of Narcan. I don't know what they call it, but it's like a CPR class. Yeah. And they give us those. And we have those at churches and stuff. But what I do notice is these white people really love white people. And I'm glad to see that you all, are African American and reaching everyone, but especially representing our community. That is so important. I haven't seen many people doing it in Black communities. So I applaud you all, because here the white people do it on a regular basis. So thank you so much.
Thank you.
You're welcome.
We have another hand raised, TJ Kimball.
Yes, I applaud you for doing this. We will connect after this. I have a program. I run First Poverty Eradication Fund, which is a global outreach program, and we have a program called Hands That Heal, which we partner with the Red Cross and the American Heart Association, and part of it is certifying instructors, and we have a grant from Duke to teach our communities not only CPR, BLS, first aid, and AED, but we're expanding it into Narcan administration, with the we're getting away from the Hippocratic Oath, and we're getting into what is called to preserve life. I'm a military physician, and we are focused on military medic training in our community, so that we stop this gawking and looking at people bleed out and collapse, to actually take action in our communities to save lives. So we will, in the breakouts, we'll talk.
Yes, absolutely.
And be sure to put your name and contact.
I did.
Thank you so much. I know Jack K has
And
captured.
I'll be sure to get you in touch with TJ as well.
Wonderful.
So to connect you both. I'm looking at the time. I didn't see any other hands raised, and I'd like to. Well, first of all, thanks again for educating us all, bringing this topic to the forefront.